It's a very unfortunate season. I think the whole country is really under siege with the resurgence of the COVID-19. It's really come to full fruition at this point. And so we are seeing a lot of people getting affected. We've seen the numbers of the cumulative numbers of people who are positive, who have tested positive, has gone over 1 million. And for the past few days, as you have said, we have moved from 10,000 to 14,000. We're just around 15,000 now, very close to. And so we must say that the numbers are increasing much more rapidly than we initially thought.
The grim reality: over 1 million South Africans have been infected with COVID-19 since March. Close to 27,000 people have lost their lives to the virus. Political parties have expressed their concerns over the worrisome numbers and are pleading with citizens to obey the health regulations.
We now call on you to work with us, to work with healthcare workers throughout the country, to work with the government to make sure that we do not spread the coronavirus any further.
The Democratic Alliance has noted with deep concern that South Africa has officially breached the 1 million cases of COVID-19 as of yesterday. It is becoming very clear that the rising numbers of infections, new infections, and the fatalities across the country are putting an unprecedented pressure on the health system. And so action must be taken on a number of fronts.
This is a warning sign to the people of South Africa. People must know that coronavirus is real. Coronavirus kills people.
It is very bad, not good news at all, that we've reached 1 million mark of the infections. Though we are motivated with the recoveries, especially in the first wave of this thing, which made us to believe that we are handling it very well as the people of this country.
1 million infections and 27,000 recorded deaths is a wake-up call. The president was persuaded by opposition political parties not to call for a state of emergency, but one is urgently needed now. Parliament must step in, as government should not be allowed to deal with what is becoming an epidemic.
The EFF, on the other hand, says it is not surprised by the alarming figures.
As the EFF, we're not shocked that we have now breached the 1 million mark of infections, because in the beginning of the lockdown, this very government, through the mouth of this prepaid president, told us that 85% of South Africans were going to be infected. So the real question we should be asking, instead of being alarmed and acting shocked, is what has the government done to subvert and cushion the number of infections?
Meanwhile, the FF Plus, which previously took the government to court over the lockdown regulations in May, says they are not in favor of the new restrictions.
Freedom Front Plus's view is that we are totally against new restrictions in terms of a lockdown, but we do say that people have to comply with health protocols. And the task of the government is to ensure that the health facilities can cope with the situation and that they can enforce the health protocols that will prevent the further spread and the rapid spread of the COVID-19 virus.
There are now growing calls for the government to introduce stringent measures to flatten the curve of the fast-spreading virus and to ease the strain on the healthcare system. Natasha Phiri, SABC News, Johannesburg.